Hello and welcome to our webinar today entitled Mental Health and Addictions Access Line, Uses, Impact, and Future Potential. My name is Sarah Webster and I'm the knowledge broker with Niagara Connects who's hosting this webinar today. We also have on supporting us as our chairperson, Sarah Johnston, also from Niagara Connects. And for those of you who might be new to using this technology with us, the audio for this presentation, as you can hear my voice, is coming through our teleconference line, but the visual is provided in our online meeting room. So please make sure that you've also clicked the link included in the connection details to join us online. And what you'll see is in the meeting room, you'll see the slides move as presenters move through their presentation. And down the left-hand side of your screen is your chat pod. We do mute all of our participant lines during the presentation, and that just kind of helps us cut down on some of the background noise that inevitably happens. So please feel free to use that chat pod to type in any questions or comments at any point, and we'll certainly flag those to be addressed by presenters at the end of the presentation today. We also do record all of our webinars, and this is, we know everyone has very busy schedules, so for those that aren't able to join us today, we post the webinar online within about a week, and we'll send out a link to the webinar recording as well as a link to the slides and any additional resources talked about today within about a week to everybody who has registered for this event. So certainly please, we encourage you to forward that on to maybe some other colleagues who weren't able to join us today. Other than that, I'll let our presenters take it away. Today we have joining us Kyrsten, Boucher, and Marnie Labie from the Mental Health and Addictions Access Line. And I've had a preview of the slides, and there's a lot of really great content that we're going to cover today. So I'll turn it over to our presenters to take us through their presentation. Over to you, Kyrsten.
Great. Thank you, Sarah. Good afternoon, everybody. Thank you so much for joining us on our webinar about the Mental Health and Addictions Access Line. We're very happy to share with you about the program and what we've been up to so far. So thank you for taking the time to join us. Before we get started, we'd like to just take a quick poll just to get an idea of who's in the room. So you'll see a poll pop up on your screen there. So we're just wondering, have you ever suggested the Mental Health and Addictions Access Line as a resource for someone that you are working with? So if you wouldn't mind to take a second and just reply yes or no, just so that we can get an idea of who's familiar with the program and who may have used it. Thank you. Okay. Perfect. Thank you, everyone. Perfect. Great. So it looks like just over half of you have suggested it to a resource for someone you are working with, so that's great to see. And if we move on to our next question, have you ever utilized the Mental Health and Addictions Access Line yourself? So that would include on behalf of a client or someone that you're working with. Thank you, everyone. So it looks like the larger majority is no, so 82%. So it could be that maybe that's not involved in your role, working directly with clients, or perhaps maybe it wasn't a fit, or maybe it wasn't something you thought about before. So hopefully after today, it might be something that you consider using in the future. So to give you an idea of what we're going to talk about today, we just have a brief agenda for you. So we're going to provide a brief background on the Mental Health and Addictions Access Line first, a little bit about how it came to be here in Niagara, as well as we're going to describe to you more detail the program and how it can be used. And then we're going to talk about how the Access Line also ties into the Mental Health and Addictions Charter that was created here in Niagara and some of the key principles that are exemplified in the Access Line. We're going to discuss the impact so far and give you some examples of calls, so give you an idea of the work that's been done and the experience that callers and agencies have had so far in the community. We're going to spend a little bit of time talking about early outcomes and preliminary trends, so looking at some of the data we've collected so far, and then finish up by talking about future directions and having an idea of where we're headed. So to give you an idea on the background, there was a need identified in the community that there was challenges in terms of accessing appropriate supports for consumers, in particular the mental health and addiction system. So this conversation actually started 10 years ago around the director's table with comments that, it's hard for people to figure out where to go in terms of the system, and people were sort of ending up at the agency that wasn't quite right for them and needing to be redirected elsewhere. So there was some research on that, and we were finding that generally consumers are going to 3 or 4 different agencies before landing at the place that's the best fit for them in terms of support. So you can imagine that can be frustrating and exhausting in terms of being a consumer and needing mental health and addictions help. And as well, we want to make sure that the agency resources are being used for the people that really need them, and that people are getting to the right place to be able to access that support. So the idea grew from there, and was really a collaboration between the different directors of the mental health and addiction services in Niagara. So they came together and decided to put in a proposal, and we were very fortunate and grateful that our local health integration network supported the project, and we were able to get funding. So that funding allowed for the development of the central access point for mental health and addiction services. So sort of the idea of one call, one number. And with that, the goal in terms of setting up the program was to also supply an initial point of service by providing immediate telephone support. So the idea was to kind of move beyond the information and referral supports, and also then provide that initial service so that folks are feeling connected and supported with their first experience with the mental health and addiction system when they're reaching out to access services. So that idea of the phone support was how the program came to be operated by Distress Center Niagara. So Distress Center Niagara has been providing telephone support in the community now for 45 years using highly trained volunteer crisis workers. So we wanted to build upon that model to include the access line with that in terms of volunteer support and that 24-hour telephone support for when people needed to reach out. So the program then landed at Distress Center Niagara in terms of operation, but is really part of a big collaborative project. So when we look at the collaborating network, these are the 16 partner agencies that came together from the mental health and addiction sectors along with the community health centers in terms of coming together to provide this service. And it really has been a collaboration from the start in terms of voting on the logo and deciding how the program would run, as well as ongoing meetings to make sure things are going okay in terms of transfers and working together, information updates, all of those sorts of things. So this is the collaborating network that's really making this project possible here in Niagara. So we're very fortunate that these different service providers have come together to work together in order to create the access line. And what's great is you'll see on the list there of the different service providers that there's a spectrum and continuum of care that's available there. So services that are more immediate all the way to long-term, from moderate and mild mental health concerns all the way to severe and persistent, as well as the same spectrum in terms of the addiction support. So it's nice to see that spectrum that's available in our community. And the big thing with the access line coming to be was that there was no intention of ever changing the wonderful work that these services are doing. So these services are still existing as they always have, but our role is to help streamline who's getting to them and making sure that the right people are getting to those right supports here in Niagara. So the objectives of the access line in terms of its development and that we continue to strive for is really that first point of access into the mental health and addiction system for adult residents of Niagara. So adult involves those 16 and up, which is where a lot of the services start, though there are some exceptions. So there are some services that may start for younger youth. For example, in terms of psychosis, some services are available younger, but the intention is for 16 and up for adult. And that idea of that one call, one number. So instead of individuals needing to call around to a few different supports to see what's available to them and waiting to hear back from different agencies, one phone call that they can make to get all of the information right there. The intention was also to ensure that it's 24/7 because we know that people with different mental health and addictions concerns, their needs might arise at 3 in the morning or at different times. So really trying to make the service readily accessible and available when people need it. The other key component of the program is to provide that warm transfer to the most appropriate service. So wanting to make sure that people feel connected and stay connected. So our warm transfer, which Marnie will talk to a little bit more, involves actually connecting the person to that agency and ensuring the agency follows up directly with them so that they don't slip through the cracks, so that they feel connected and supported from the start of their experience with the mental health and addiction system. And that's what sort of sets us apart in terms of a support that's available in the community. The other big component and objective of the access line was that the directors really wanted to ensure that there was no wrong door for callers. So you don't want to get a wrong door when you're looking for support for yourself or a loved one. So, the collaborative network has agreed that they'll accept the referrals from the access line and make sure that the person gets to the help that they need, which is really nice so that folks aren't slipping through the cracks here in Niagara. The other objective, as I spoke to a bit before, was really that idea of immediate support. So we want to make sure that people are feeling supportive. So the way we approach our service delivery moves beyond sort of a checklist or information and really going on to having a conversation about what's been going on with the person, providing emotional support and validation, crisis de-escalation when needed, talking about coping skills and that sort of thing with individuals so that they feel supported right away when they're starting to access the mental health and addiction system, which we know is super important for stages of change and helping people feel motivated to continue on getting support. And we also know allows us to get more information and help them open up so that they can share a bit more to make sure we are getting the right support for them. The other objective with the access line was to also ensure that the client receives service by completing follow-ups. So again, Marnie will talk a little bit more about what that looks like, but making sure that we're following up with the agencies to make sure that individuals are getting connected to the support that they're needing, again, to keep them connected and make sure people aren't slipping through the cracks. So in order to achieve these objectives, I'll just tell you briefly about our fantastic team that we have here. So we have highly trained Distress Center Niagara volunteers. So our volunteers start on the volunteer crisis line. So they have 21 hours of classroom training for that and skills in crisis de-escalation and suicide intervention, as well as then 29 hours of training for the access line specifically on the programs and the criteria and all of those different pieces in order to be frontline responders on the access line. So we're so grateful for the volunteers that we have involved with the program in Distress Center Niagara. They've always been the core of Distress Center, and they're really what allow us to be able to do this work as well. That said, if we have anyone out in the audience there who's interested in potentially volunteering, we're always looking for new volunteers, so let us know. And our community access workers and system support staff are really the core piece that allows us to do those follow-up with the agencies and make sure that people are getting connected to services. So those staff are working hard to follow up with any referrals that are done and make sure that the person gets connected, keeping track of all of that, keeping up-to-date client files and records, going out and doing outreach and presentations in the community, as well as being that mentor there for the volunteers and support. And then my role as team leader is to liaison with the different community partners, setting up protocols, and as well as providing the education and training for the staff and volunteers on the line. Perfect. So now Marnie's going to tell us a little bit about how the access line can help and what that actually looks like.
Thank you, Kyrsten. So the phone responders will discuss with the caller what their needs are and help determine the most appropriate service for that individual, while also providing support to them. As Kyrsten had said, it's more of a conversation. We explore what led them to the call that day, how they're coping, if at all, are they using anything to cope, how it impacts their day. It's all through this conversation that we're able to kind of glean where the best service will be. And at that time, the client can be warm transferred to one of the partner agencies, either by way of a three-way call or by providing the receiving agency with the information so that they can follow up directly with the client. And this transfer is based on the protocols that have been established, which I'll speak to shortly. Also at this stage in a conversation, if we aren't speaking directly to the client, we can provide the third-party caller with the same information about the services and encourage them to have the client call us directly so that we can complete a referral or they can follow through on their own. Okay? So the protocols, this is the backbone of our referral process. Protocols have been established with each partner agency. These protocols have been determined as a process for referrals in order to ensure a smooth transition for that individual. And the protocols are unique to each agency, okay, and it best suits their existing process. So for example, the protocols allow for how we're going to reach out to that agency. Is it by phone, email, fax, whatever way we're going to transfer the information to them. It's all been established. And then also they've determined in what time frame they'll get back in touch with us to let us know that they received the referral. And then there's a time frame that they've established based on their own protocols again, that as to a time frame when they will initiate first attempt to contact the client, because that's the important thing. We want to make sure people are getting connected as quickly as possible. The wonderful thing about that is we can actually tell the caller, the client, when they should hear from them by, and if they don't, we invite them to call us back. The agency individually decides how many attempts they'll make, and then at the end of it all, they inform us of the date and time when they have made attempts and when they've made connections, and then what the outcome has been. So we really rely on those protocols, and we can adjust them as needed. So in addition, with our knowledge of some programs having wait lists and so on before a client would begin to receive a service, the access line is able to offer interim or crisis programs as well, such as urgent support services or COAST. That way they still will get that initial connection from the by the referral agency, but we can also keep them connected by the crisis supports until they're able to go to program. The current information on programs are updated to us by the partners, and that allows for accuracy of information. If they're adding programs or taking away, or they can give us rough ideas on some wait lists and so on. This helps by saving the clients, the family members, friends, and community agencies the time and effort in having to search on their own where to receive the most suitable service. We also help reduce the workload on behalf of the caller, as we will follow up directly with the transfer agency to ensure that they contact the client and connect them to services. Okay? So Kyrsten?
Perfect. Thank you, Marnie. So now we'll talk a little bit about how the Mental Health and Addictions Access Line ties in with the Mental Health and Addictions Charter. So the Access Line sort of exemplifies some of the key charter principles. The first one being that partnership. So just like the charter was a partnership of various people in the community coming together in its creation and development, so was the Access Line. So the Access Line has been a key partnership since the idea, the proposal, and now the ongoing running of it. And we actually wouldn't exist without the collaboration and the hard work that came together from that collaborative network. And this partnership continues on in terms of looking at the protocols, doing updates, changes to the protocols, and the agencies being able to work within those and getting back to clients so quickly, and all of those wonderful things that are really making the Access Line what it is. It's also really started that coming together of agencies in the community and stopping that work in silos that's sometimes done because everyone's so busy delivering service to the community. It's really that opportunity to come together, share what wonderful services are being provided by the partners, and work together in sharing what's being offered, what's new, what's changing, all of those pieces. So really coming together as a community to provide support. And that ties into that knowledge exchange piece. that strong partnership has allowed for that knowledge exchange to happen, and the agencies updating the access line of what's going on with them, which is really great that we have that centralized knowledge in the community about eligibility criteria and changes to programming and all of those things so that it's accessible to the community, which ties into the information component. So as Access Line, that's probably our biggest contribution to the community that we can offer is having that easily accessible, reliable, and open source of information. So anyone can call for information at any time, and we'll be able to provide that to them for themselves or a loved one. So individual and family-centered services, our philosophy is very client-centered and making sure that we're meeting people where they're at. So sometimes it can be scary to reach out for help and think, am I going to have to commit to anything? Am I going to have to agree to accept a referral? And that's not the case. We'll absolutely support callers wherever they're at in terms of their own stage of change, their own readiness, and what they identify their needs are. So we're very client-centered in that aspect, as well as in the approach in terms of the support we provide. So when folks are calling in, it's a very supportive conversation. Sometimes they're not even aware that when we're talking to them, we're actually sort of ticking off eligibility criteria and looking at things like that, because it's very much a supportive conversation about what's going on. There's emotional validation, there's reflection, there's de-escalation, all of those pieces that are happening to make sure we're meeting the person where they're at and making sure that they feel supported. In terms of family members, families and different social supports are welcome to call us as well, and we do see calls from these individuals wondering what's available for their loved one, which is so important for them to know their options in terms of what's available for them. So sometimes to present that to their loved one or just for their own peace of mind and knowing. And what's nice when they call in is, we're having that supportive conversation, and then we're also asking them how they're coping. So sometimes the family member themselves actually might need support, so then we're able to explore that a little bit with them and see if there's anything we can connect them to as well for themselves, which Marnie will talk about a little bit more in terms of examples. And then inclusivity and respect. We strive to make sure that we're exemplifying this in all that we do, and we have a very non-judgmental and open approach to all of our callers. So all beliefs, values, choices are respected, and supporting them, like I said, where they're at. So not forcing or suggesting that they make a change, not giving them advice, but following an empowerment model, really respecting where they're at, and focusing on whatever choices they want to make at that moment. So, depending if someone's currently using substances and not ready to give that up in that moment, then that's absolutely their choice, and we respect that. We don't try and force resources on them in that regard. So being very inclusive and open so that hopefully everyone feels welcome to call.
Okay, so the impact. The Access Line has brought together community partners. It has been a platform and a focus for partnering agencies to continue with the work that they do and to work together in order to meet the needs of the community members that they are serving. Agencies have identified changes, so we've had testimonial of partner agencies that have included an increase in their numbers because of increased awareness of their programs, as well as an ease to access their program. An example of this is a very small but mighty agency is Consumer Survivor Initiative. They've experienced a big increase in the size of their groups compared to the past. As well, we have had feedback from some agencies that the protocols have helped to streamline their own processes, as well as having provided them with data collection opportunities. And the value of that, we all know, is that it will help to identify future program needs and development for the agency and filling in gaps of service. And I do feel that it's important to also mention the qualitative piece that data does not capture. So responders, when we're on the phone, we can hear the tone of in a caller's voice as they settle, their expressions of thanks. Sometimes we get callbacks when, if it's a third party and their loved one's been connected. So it's made a big impact on people and made that whole process much easier for them. So let's get that slide over. So we have Gateway has provided us with a testimonial on the impact of the access line for their agency and for their consumers. They identified that with the one access referral system, individuals are able to get the services they need without having to tell their story over and over again, and all in as little time as possible. This speaks again to the time frames of when agencies are agreeing to reach out to the client and how many times they'll attempt to connect and so on. So those protocols are really the backbone, as I said before. So the impact on call experiences. This is where I'm going to share some actual anecdotal information. So a common call that we do receive is a client feeling that they need to see a psychiatrist. That could be because somebody told them that, or they just feel that that's what they need. So what happens during any call is we will explore what has been going on with them, perhaps talk about any services that they've had in the past or possibly have currently. And as I talked before, and Kyrsten also said, you know, you're having a conversation, and then we're following their lead on the conversation and pulling out information as we need it. So, and then as we're doing this, we're able to find out what would be helpful. We ask them that directly. In this particular example of a client asking for a psychiatrist, we have the opportunity to educate them about the role of a psychiatrist, the role of the family doctor. Then we talk about possibly counseling and what that offers, groups, and crisis support. And from then we are able to provide them with a referral to the service that they're identifying as being something they would find helpful. Quite often it's something they hadn't really even considered. Okay, so we do, as we said before, we do get a lot of calls, third-party callers, either family or friends, even neighbors, other community members who are dealing with someone who is struggling with an addiction or with mental health symptoms. And maybe the client is too anxious to call, or perhaps they don't even identify as having a problem. But the caller is looking to see what's available. So whatever the reason for their call, we provide the same support, and then we will provide information to that third-party caller. We let them know that we aren't able to provide a referral without speaking directly to the client, but we will give them all of the information about the services and encourage them to have the client call directly or with the third party's help. We get that quite a bit as well. So during a third-party call, we often find that the caller is also in crisis as a result of the client's issues. A young girl looking for support for her father's addiction, and in the process of the call, she shared the impact it was having on her. She told of how she doesn't know what to do to be supportive with him without enabling, and how it impacts her day. So this conversation allowed us to share services that were suitable for her as well. And in this case, it was WARM, the Women's Addiction Recovery Mediation. So we were able to provide her a referral, and she felt very supported. And then she also felt very settled with the information we provided her for her dad. So that turned out well. We also get calls from family doctors' offices who are supporting a patient and wanting to explore services. So for example, we've had a call from a doctor's office who had a patient that was being discharged from a treatment center up north, and they were looking to get the patient connected to services as part of his continuum of care. So they called to find out what would be the most suitable program to help move their patient forward. So we were able to offer that information. The third type of call is from frontline staff, and I can attest that there is a lot of information to know about the various programs and who would be eligible or suitable for each program. We feel the relationship with frontline workers is very important and valuable for the provision of the service. To know all of the criteria of every program, that is our role, and if we can help you with connecting clients to service, then that is a wonderful thing. So we really enjoy those calls. That way you can continue to focus on the support that you provide to them, and we can provide you with the information for referrals. I had a frontline worker who called us, and she had made an appropriate referral to Impact for her client, but she was also looking for other supports. So when in the conversation and the details of the client's circumstance came out, we were able to provide her with information about a program specific to the psychosis for which the client had met criteria. The caller said that she felt much better about the specific program and was going to move forward with this on behalf of the client. So that would have possibly, the client was still being served, but this was something that was enhanced to his service. We recognize that frontline staff have enough to do in their usual duties, so if we are able to troubleshoot something for you rather than you calling around to see what's available, we are very happy to do that. It may simply involve a confirmation of something you've already felt that the client is suitable for, but we may also bring something else to the table for your consideration. And we are truly happy to receive those calls. Okay.
Great. So now we'll just spend a little bit of time looking at some of the stats that we have so far for the program. So the Access Line officially launched on May 9th of 2014, though we were piloting sort of beforehand before we went public. So we've started with data from our first fiscal year in April 2014 up until the end of February of 2016, so that you get a picture of what we've experienced so far. So there's been over 2,100 individuals served since our launch, and over 2,600 calls to registered service recipients. So these are the individuals who are choosing to leave their information with us to register as a client. So in addition to those numbers, we also have folks who choose to remain anonymous at that point calling in as well. And we've so glad that we've been able to connect over 1,000 individuals to a mental health or addiction service provider via that warm transfer model. So these are individuals that have consented to a referral to an agency, and we've been able to directly link them to that service provider. And what's very exciting to report back is that over 83% of callers are connected within 1 day. So the average wait time from when someone calls the Access Line to when the service provider is reaching out to them to get them connected to their agency is 1.26 days. So that really speaks to the partnership and the collaboration within the network, and all those agencies working hard to make sure that people are receiving service and support. So we're very grateful that we can report that back, and our callers really appreciate being able to hear back so quickly and get connected to the support that they were looking for. Also just exciting to report back that over 1,600 callers have indicated they feel better at the end of the call. So Marnie sort of spoke to some of those qualitative pieces, but that's a nice number to support that as well, that these folks are actually indicating that it was helpful and that they feel better after calling, which is nice, that sense of relief that individuals are having in terms of getting connected to support. So in addition to the incoming calls that we've experienced, a big role of our community access workers is to confirm those connections with the partner agencies. So reaching out to make sure that those contacts were made and keeping track of when that is occurring for our clients. So there's been over 2,000 follow-up contacts made with the partner agencies as well in order to achieve that goal. We've had over 800 calls in terms of providing service to third parties, over 60% of which are family members. So there's definitely a need out there for that family support and family members wondering what type of help is available for their loved ones, or maybe looking for help eventually for themselves as well. So we're happy to be able to provide that support to them and hope that continues to grow. And about just under 30% of our third-party calls are service providers, like Marnie spoke to, calling to wonder what's available to their clients, and we want to keep encouraging folks to do that as well, like Marnie said, so that you can focus on the support that you're providing to your clients in your role and help get people connected as quickly and easily as possible. To give you an idea of some of the trends that we're seeing in terms of mental health concerns, I know it's kind of, the writing's sort of small, but I'll go over it with you. So just want to highlight the main trends that we've seen. So in terms of the most common, we have mood disorders, which is about 30% of the mental health concerns we see. So depression, bipolar, pretty common for folks to be struggling with and needing support for. Followed closely behind that, about 20% of our callers are struggling with some sort of anxiety disorder. So depression and anxiety are sort of the predominant that we see. Schizophrenia and psychotic disorders making up just under 10% as well. And it's nice that the collaborative network within which we work really has that spectrum and continuum of services available to reflect the different needs that are here that we're seeing. Post-traumatic stress disorder, I'll just point out, is only about 4% who are diagnosed, though we are sort of seeing a lot of people with a history of different forms of trauma, from their childhood or more recently that they're struggling with, though not formally diagnosed. So we expect that's something that we'll continue seeing as we move forward. In terms of addictions, most common being alcohol is the most common addiction that we're seeing, along with non-prescription drugs. So things like cocaine, as well as maybe taking drugs that are prescribed to others. So things like Percocets, Oxycontin, that sort of things are what folks are struggling with. Additional caller needs. Housing is a big concern here in Niagara, which I'm sure most of you listening in are aware of, but about 35% of individuals are struggling with housing in some regard. So that could be lack of affordable housing, struggling to maintain rent, or actually being homeless and needing help with housing. Financial concerns are also quite high with 16%. Activities of daily living is another component here that's about 15%, but we actually expect this number to be a bit higher. This was sort of something that we started noticing anecdotally in calls and wanted to add actually a field in our database to be able to track it. So we started tracking this about halfway through the data so that we can start to look at emerging trends. So activities of daily living, so these individuals are struggling to maintain a clean home, to balance their budget, to get to appointments on time, do groceries, cooking for themselves, that sort of thing. So definitely something that we want to keep looking at in terms of a trend and a need in the community. So as we look ahead to our future intentions, we want to really continue building that relationship with frontline service providers as part of a continuum of care in Niagara. So working with different frontline service providers to get their clients connected to supports if they're in need of more help, really to help make sure that people are getting to where they need to be and helping taking the burden off of some of the agencies themselves in terms of getting the clients connected to other support. With that, we want to include primary care providers. So recently, we've been really reaching out to physicians and different primary care providers to let them know about the service and see how Access Line can be a part of that continuum of care to get their patients connected to the help that they need. And the response we've had so far is quite positive. So we want to continue to build those relationships. Looking ahead, we also want to have roundtables with our collaborative network agencies to build the existing relationships we have, celebrate the work that's been done by everybody, and get feedback for future directions and opportunities for growth and change as we move forward. We'll continue to be available to help streamline referral processes and data collection for partner agencies. So as said in the testimonial, it's been really successful for some of our agencies, like Gateway as an example. So we're always available to help if other of the collaborative network agencies want to look at streamlining their referral processes. We're here to help in any way we can for that as well. And we want to continue to work to strengthen the partnership and knowledge exchange in Niagara by being that central access point of the information and being readily accessible for everyone. And as more calls are taken, we expect that more trends on the community needs and gaps are expected to emerge. So we want to be able to share that with the community in terms of knowledge exchange so that we're aware of what's happening in Niagara. So in terms of contact, there's our contact number there. So we have the 1866 number. Some of you may know it is shared with Coast Niagara. So if someone's in crisis, they can reach Coast Niagara by pressing 1 when they dial the 1866 number. Or if they press 2, they reach the Mental Health and Addictions Access Line. So it's sort of nice in that one number has both crisis and connection to services within it. And it is available, like we've talked about, 24/7, 365 days a year for individuals to call. And anyone looking for information about the services available in Niagara is welcome to call. So like Marnie said, we need client consent in order to do the actual warm transfer piece, but anyone's welcome to call for information. Even if you're a frontline service provider and you don't necessarily have a specific client in mind, but you're wondering, what's available in terms of anxiety support or something like that, you're certainly welcome to call and we'll help you out with that. We also have information available on our website, and you can like us on Facebook as well and follow the different posts we have on there. We'll have contact information at the end as well for myself and Marnie, so if there's any kind of follow-up questions, or if you would like a presentation maybe to your agency, if you want us to come out, we're always happy to provide information sessions, or if you're looking for materials for cards, that sort of thing, we're certainly happy to help with that. So just in closing, we want to thank you so much for listening to our presentation. And we just have 2 follow-up questions here to kind of help get us an idea of how helpful this has been. So if you wouldn't mind to take a moment and just respond. So after this presentation, it is likely that I will use the Mental Health and Addictions Access Line in my work. So if you wouldn't mind to let us know how you feel about that, or if that's applicable or not for you, that would be great. Thank you, everyone, for responding to that. So it's great. 43% strongly agree and 46% agree, so great that it's helpful in terms of your work. And for those of you who it's not applicable for, definitely understandable. And some of you disagree, maybe it's not useful for you in terms of the work that you provide, but certainly if you have any questions that might help clarify anything, we'd be happy to answer. And one last question, just wondering how this presentation was for you in terms of increasing your knowledge about the Mental Health and Addictions Access Line, just feedback for us in case there's anything else that we can provide in future. So if you wouldn't mind to take a moment and fill that out, that would be fantastic. Thank you, everyone, for responding. So great, fantastic to see that this was helpful for individuals. We'll keep that feedback in mind moving forward. So thank you so much for participating in that. So at this point, we're certainly happy to open it up to any of the questions that may have come in. We'll open it up for questions.
Great. Thank you so much, Kyrsten and Marnie. We have had some questions come in through the chat, so please, for participants, feel free to continue using that platform. In addition, if you'd like to ask any questions verbally, you can do so by pressing *7 on your phone to unmute your individual line. But I will work through some of the chat questions first. Marty asks, if someone calls 211 first, is there warm transfer between 211 and the access line?
Good question. The calls that we've had referred from 211, we've had a mixture of 211 warm transferring, like directly calling by three-way call, or we've also had people who have said 211 suggested that I call you. So sort of a mix of the both, but 211 certainly welcome to warm transfer to us if they have individuals that are a fit for the program.
Great. And Miranda asked for clarification, when did the access line officially launch then?
Yes. So May 9th of 2014 was our official launch date, and the program development for that started at the end of 2013 in terms of setting up protocols, and we started piloting before our official launch, but May of 2014 is when we became public.
That made it official.
Yes.
Great. Brittany says, we are wondering how we can acquire some business cards for Access Line Niagara to have on hand to give customers when we feel it might be helpful.
Fantastic. Great. Yeah, anyone who's interested in getting materials, they can call the Access Line directly and let us know that you're looking for materials. Or Marnie and I's emails will be available at the end of the presentation too, so whatever works better for you. You can contact us via email or by the Access Line itself.
Perfect. And I'll actually put that contact slide up just so that people have time to jot down those email addresses as well. Michelle asks, do you have bilingual support for callers?
Yep, great question. So we're always looking for bilingual volunteers. So if you know anyone who speaks a few languages and is interested in volunteering, we would love to have them. If we're not able in that call, if the person responding isn't bilingual, then we would try and access an interpreter via 211. They have interpreters available. One of our partner agencies, Centre de Santé, of course, is bilingual, so sometimes it might be linking them to that service as well if that's the need.
Great. And you had talked about in your stats about some of the different most common issues that you see from callers. Heather asked, can people call the access line for eating disorder issues?
Eating disorders? Yes, absolutely.
Yeah.
So the Niagara Health System that we're partnered with does have a program for eating disorders, so individuals are certainly welcome to call us for information on that.
Great. Karen asks, have you seen anything about the access line changing wait times with any partnering services? Example, speeding up or slowing down access in any way?
Not that we've seen in terms of wait times for their service. For example, Consumer Survivor Initiative that Marnie touched on was sort of a not as well-known agency, so us getting people to them at one of their groups did fill up, but they still have other groups available at this point. The agencies might be able to speak a little bit better about what their actual wait times and the impacts that has been, but sort of what we're noticing at least is that the agencies are able to get back to the individuals very quickly to get that started, but definitely something we want to kind of look at in terms of trends to see if that's having an impact. I imagine on some of the smaller ones, like Consumer Survivor for Initiative, for example, it's impacted how many people they've had in their groups. But in terms of being overwhelming in terms of increasing wait times, we haven't had any feedback like that.
Great. Kyrsten asks, are you able to help facilitate complex care meetings with participating agencies?
So there is a complex case table. I'm not sure if that individual is involved with that, but there is a complex care table that meets in Niagara with the different service providers. If there's ever a need and they want to invite us to the table, we can certainly help in terms of looking at what's available for an individual. Best way to kind of start that is to call the access line and see what might be available in that regard as well. And a lot of the collaborating network already sits around the table, so that there is that representation there. But if there's a need, certainly we'd be happy to see what we can do.
Great. Mary has asked, have you had any challenges matching the demand or traffic on the access line to resources available?
Yeah, so call traffic is always sort of one of the challenges with a telephone service. So what we're noticing is that our highest call volume is during the day, sort of 9 to 5 during the day, which is interesting because we are 24 hours, so people can call us whenever, but they seem to like to call us during the day. So sometimes all of our responders are busy, and it can take a little bit to get back to individuals. Sometimes that could be as much as 5 minutes just finishing up with the call, or sometimes if we're on, say a call with somebody who's in crisis, it could be a little bit longer and be an hour or two before we can return the message. So something we'll continue to look at and monitor as we increase in call volume.
You were talking about the network of collaborating partners. Janet asks, can other agencies join the partnership at this stage?
Okay, great question. Kind of one of the future intentions is looking at how we can continue to look at the knowledge exchange in Niagara. Currently, the folks that are at the table, that's sort of what we're funded to be able to provide. But if there's, definitely we'll take feedback if there's other agencies that are interested in joining, and we can, kind of take that to advisory and see if that's a possibility moving forward.
Karen says, you've talked a lot about the successes. Congratulations. Have there been any challenges that might be helpful for communities to consider going to a one-number access line?
There's always challenges in terms of starting up a new program. So access lines are very new across Ontario. So what was sort of challenging was not really knowing what to expect or how to base it because it is so new. So the access lines that have sort of popped up across the region and Ontario are very different in terms of the services of their partnership and how they provide service, if they're 24 hours, if they're not, if they're doing intake and assessment, if they're not, that sort of thing. So it's kind of really looking at what it is that the community needs and wanting to provide and making sure it's a fit with that. And really just working hard at those partnerships. Some of the unexpected things when we were setting up the protocols was just, from the agency's point of view of, we've never had to think about what that looks like before or figure out what that would be like if somebody was sending people to us in that way. So it's been a really good process to walk through and see what's all involved in that. So I guess really wanting to have an idea of what the intention of the service is going in to make sure it's meeting that, just because all of the access lines are so different.
And on that, Kyrsten, then, do you stay in touch with other access lines? Like, is there a platform for you to share with other lines across the province just to learn from each other as you're each working through those processes?
So we did consult with them when we were first in development and starting. A lot of them are quite different. So, for example, one of the other thing we want to do in future is really connect with them, see how things are going, and are there things that we can take from them to improve our own service.
Absolutely. And Julia asks, would someone be able to call the access line if coastlines are busy and someone is suicidal? So, or is there a better referral for that?
So if someone's suicidal and in that moment, if there's not that immediate risk, because of course if there's that immediate concern, it would be an emergency response. There's also Distress Center Niagara. So Distress Center Niagara has the 24-hour crisis lines available. Sometimes those can be busy as well as coast. So if someone got through to the access line and was in crisis, we'd absolutely be able to provide support to them. All of our responders are trained in crisis and suicide intervention. So we'd make sure that they're safe in that moment. And then once that's taken care of, then we can definitely link them back to whatever crisis service might be the fit for them. Just knowing the intention isn't for it to be a crisis line, but absolutely if someone's struggling, we'll definitely talk with them and offer support.
Not turn them away. I'm going to pause there. Any questions or comments verbally that people would like to share? You can unmute your individual line by pressing *7. Pause. Okay. Well, thank you very much to both our presenters today for sharing this information, not only about a service that will certainly continue to be used and then hopefully more so, and helping raise awareness in the Niagara community, but also sharing some of those early impact components that you're starting to see as well. That's helpful. So we will send out a link to the recording, a link to the slides, and additional resources within about a week to everyone who registered for the event. When we close the line and close down the meeting room, participants will be redirected to a short evaluation survey for us at Niagara Connects, just to help understand and make sure that we're meeting your expectations and your needs. And certainly as well, you'll be redirected from there to our sign-up form if you're not already on our distribution list. We encourage you to sign up. We've now moved to sending weekly e-blasts to highlight new events, new resources, partnerships, and community blogs that have been shared on the Niagara Knowledge Exchange. So it's definitely a great resource to get quickly into your inbox. And as well, by being on our distribution list, you'll receive invitations to future events such as this that we're hosting going forward. So please do consider that. And if you have any questions for us or our team, our contact information is up there as well, and we're always open to have a chat with people. So thank you very much. And other than that, enjoy the rest of your afternoon, everyone. We'll be talking to you soon. Take care.